Usually when we talk about a medical diagnosis, there's this expectation of just absolute precision.
Right, like it's engineering or something?
Yeah, exactly. Like if you break your arm, you go to the hospital, they put you in an X-ray machine, and that image comes back showing a jagged white line right across the bone.
Very binary.
Right. The doctor points to the screen and says, there it is. That's the problem. It's broken or it's not broken.
And, I mean, it's deeply comforting to look at the human body that way.
Oh, totally.
We're pattern-seeking creatures. We really like our problems to be highly visible and mechanically straightforward. A pipe is broken, so you patch the pipe.
But then you step out of that simplistic view and into the actual world of biological engineering, specifically like human biomechanics.
Which is incredibly messy.
It is. Suddenly, that X-ray machine feels like it's only giving you maybe 10% of the story. You start looking at the structural landscape inside your own body. That is a brilliant, hyper-complex marvel, but also, and this is the crazy part, terrifyingly fragile.
Yeah, because the reality of human anatomy is, well, it's rarely a matter of simple, rigid structures. It's this dynamic, fluid negotiation between opposing forces.
Right.
And honestly, nowhere in the body is that negotiation more extreme or more precarious than in the joint we are examining today.
Which brings us to the core of this deep dive. If you are listening to this right now, I want you to just think about something you use thousands of times a day, but probably take entirely for granted.
You use it to reach the top shelves in your kitchen, right?
Yeah, or to put on your jacket, or just to steer your car. Today's stack of sources comes to us from the really fascinating clinical work and biomechanical breakdowns presented by Dr. Christophe Delong, along with the extensive anatomical research compiled by Connexaformation.
It's a great stack of research.
It really is. And all of this material centers on one specific, incredible piece of biological machinery, which is the rotator cuff.
Yeah, and when you really dig into the literature from Dr. Delong and Connexaformation, you start to realize the rotator cuff is arguably one of the most sophisticated, intensely studied, and frankly baffling anatomical complexes we have.
Baffling is a good word for it.
I mean, it defies a lot of standard engineering logic.
Okay, let's unpack this.
Yeah.
Because our mission today isn't to just recite a dry textbook medical breakdown of shoulder muscles.
No, that would be completely missing the point.
Exactly. We are going on an exploration of a profound evolutionary compromise. We want to figure out how the human shoulder achieves the absolute greatest mobility of any joint in the human body.
And why it is notoriously prone to falling apart as we age.
Right, and we want to uncover the brilliant, completely invisible mechanisms that keep your arms from literally dropping out of their sockets every single time you pick up a coffee cup.
It's a miracle they stay attached, honestly.
Seriously. And to help us navigate this incredibly complex biomechanical web, I am joined by our resident analytical guide. Your job today is to help us connect the dots between ancient human evolution, high-level physics, and the everyday aches and pains that someone listening might be feeling in their shoulder right this very second.
Well, I'm ready. And I think looking at the shoulder through the lens of evolutionary biology really changes everything.
How so?
Because you aren't just looking at a collection of tendons and bones. You are looking at the literal price we paid to become human.
That sounds dramatic, but the sources back it up.
They do. It is a structure that actively sacrificed almost all of its inherent stability for just total freedom of movement.
Let's hover right there on that idea of an evolutionary compromise, because the primary biological paradox laid out in our sources is just stark. The numbers alone are staggering.
Oh, the degrees of freedom.
Yeah. The shoulder possesses an astonishing 1,800 degrees of cumulative angular freedom across 3 spatial planes. I tried to visualize that earlier, and it essentially means our arm operates in a nearly complete sphere of influence.
Right, think about the three-dimensional space immediately surrounding your body.
Okay.
If you extend your arm, your hand can reach almost any single coordinate in that spherical space.
Yeah, I can scratch the middle of my back. I can reach straight up toward the ceiling.
You can cross your arm tightly over your chest or extend it perfectly out to the side. I mean, there is virtually no dead zone.
Which is wild.
It is. No other animal on Earth possesses that exact combination of massive hemispheric reach combined with fine, delicate manipulation at the end of that reach.
But the clinical texts make it clear that a joint doesn't just get 1,800 degrees of freedom for free, right? There's a massive structural cost to being able to reach behind your back to grab your seatbelt.
An enormous cost. And to understand why, you really have to look at the geometry of joints. When most people hear the word joint, they picture a classic ball and socket mechanism.
Right, like a joystick on an old arcade machine. Something firmly and deeply locked into place where the ball is trapped inside a cup.
Exactly. And that is exactly how your hip works.
Oh, the hip is like the tank of joints.
Yes. The hip is the gold standard for a reliable, load-bearing ball and socket joint. The head of your femur, your thigh bone, is a large ball that sits incredibly deeply inside a thick, bony cup in your pelvis.
The acetabulum.
That's the one. In the hip, you have roughly 70% bone-on-bone coverage.
70%, so it's really locked in there.
The cup literally swallows the ball. That deep socketing makes it incredibly stable. I mean, it bears your entire body weight effortlessly.
And it's super hard to dislocate, right?
You need a catastrophic trauma, like a high-speed car crash, to actually dislocate a hip.
So the hip is a fortress, but based on these anatomical diagrams from kinematics, the shoulder, well, it looks like it was designed by someone who completely forgot about gravity.
The shoulder is the antihip. It really is. The main shoulder joint, which is technically known as the glenohumeral joint, operates with only about 25 to 30% bone-on-bone contact.
That sounds like a recipe for disaster.
It kind of is. The head of your upper arm bone, the humerus, is this very large, smooth sphere. It has a radius of about 25 millimeters.
Okay.
But the socket it rests against the glenoid cavity on the edge of your shoulder blade isn't a deep cup at all.
What is then?
It's very shallow, slightly concave, almost flat surface.
There is a visual analogy in the sources that I absolutely cannot get out of my head because it is so incredibly anxiety-inducing.
Golf ball.
Yes. They describe the shoulder joint as being literally like a golf ball balancing on a golf tee.
It's the most mechanically accurate analogy you can use, honestly.
It's terrifying.
Picture a standard dimpled golf ball resting on a small wooden tee. Now imagine holding that tee in your hand and try to move it around in three-dimensional space.
Right, so you tilt it horizontally, you try to turn it upside down, you spin it around quickly.
And while you're doing all of these chaotic movements, you have to keep that unattached golf ball perfectly balanced on the tiny surface of the tee without it rolling off.
That is insane.
That is the exact physics of what your shoulder is doing right now. You have minimal bony stability, maximal mobility, and a permanent, ongoing, lifelong risk of dislocation.
Okay, I have to push back here. From an engineering standpoint, 25% contact is atrocious.
It's terrible.
If a structural engineer built a bridge where the support columns only rested on 25% of their foundation, they would go to prison.
They absolutely would.
So if this is such a precarious, inherently unstable setup, why hasn't evolution fixed this? If it's so incredibly prone to just falling off the tee, why did nature leave us with this apparent design flaw?
Well, when you look back at the timeline of hominid evolution, you realize this isn't a flaw at all.
It's a feature.
It was a highly deliberate, highly successful survival strategy. It is the biological tax we paid for our species' dominance on this planet.
Okay, you have my attention.
To understand why we are built this way, we have to look back at our ancestors millions of years ago during the transition to bipedalism.
When we started walking on two legs.
Exactly. When early hominids stood up on two legs, the mechanical requirements of the body shifted dramatically.
Because we stopped using our hands to walk.
Right. Think about a quadruped, like a dog or a bear, walking on all fours.
Okay, picturing a dog.
For them, the front limbs are weight-bearing columns. Gravity pushes straight down through the bones from the shoulder down to the paw, effectively locking the joints together through compression.
Oh, so the earth pushes up, gravity pushes down, and the bones just become a solid, stable pillar.
Precisely. But the moment our ancestors stood completely upright, the entire orientation of the shoulder joint rotated 90 degrees relative to gravity.
So the columns suddenly weren't columns anymore.
No, they became dangling pendulums. They became suspension bridges. The human shoulder had to suddenly adapt to carrying the entire weight of the arm hanging in empty space. It's working against the downward pull of gravity 24 hours a day without the benefit of resting on the ground for compression.
We basically traded a solid, weight-bearing pillar for a crane.
We did. And by opening up that joint, by actively making the socket shallower and reducing the bone coverage down to that terrifying 25%, we freed our hands.
We untethered them.
Exactly. We untethered them from the rigid mechanics of walking. And that specific anatomical freedom allowed us to do something that literally changed the trajectory of human history.
Which is what?
The ability to throw.
Wait, throwing,
Ah,
like chucking rocks and steers, that's what drove this massive evolutionary shift.
the art of the throw is one of the most defining characteristics of human biomechanics.
I had no idea throwing was that important.
It's huge. Our shoulder is uniquely, almost obsessively optimized to store and release elastic energy.
How does that work?
When you pull your arm back to throw a baseball or a javelin, you enter what biomechanists call the cocking phase.
Okay, like pulling back a slingshot.
Right. During this phase, your shoulder goes into extreme external rotation. You're peeling the arm backward, rotating that golf ball outward on the tee to an astonishing degree, often over 170 degrees of rotation.
Just picturing the arm cranked back that far makes my shoulder ache. It looks unnatural.
It looks violent because it is.
Yeah.
In that position of extreme external rotation, the muscles, ligaments, and tendons of the front of the shoulder act exactly like a heavily drawn bowstring.
So they're just loaded with tension.
They are stretched to their absolute physical limit. They're storing a massive amount of kinetic and elastic energy. And then, in a fraction of a second, they release that energy brutally, whipping the arm forward to propel an object.
But surely other animals can throw things. What about chimpanzees?
What about them?
Well, they are our closest primate relatives. They swing from trees all day, and their upper bodies are famously incredibly strong. Can't a chimp throw a rock just as well as a human?
You'd think so, right? A chimpanzee has immensely powerful shoulders. Their muscular density for pulling, hanging, and crushing is far superior to ours.
Right.
But if you actually observe a chimpanzee trying to throw an object with purpose, it looks incredibly clumsy.
Really?
Yeah. Dr. DeLong's clinical texts use a wonderful French expression for this. They describe a chimpanzee as throwing comme un savant,
Which means
like an old boot.
like an old boot. That's a great visual, just sort of lobbing it awkwardly.
Yes. They have almost no accuracy and generate very little speed.
Why, though, if they're so strong?
Because their shoulder bones and joints are built for hanging and pulling.
Okay.
Their sockets are too locked in, too deeply set.
Ah, so they don't have our golf tee setup.
Exactly.
Yeah.
And their ligaments are too tight to achieve that extreme 170-degree external rotation. They cannot draw the bowstring back. Humans, on the other hand, sacrifice that hanging stability to pull the arm impossibly far back. Because of that, during a professional baseball pitch, a human being can achieve internal rotation speeds of 7,000 to 9,000 degrees per second.
Wait, 9,000 degrees per second? That sounds like the RPM of a car engine, not a human arm.
It is considered one of the fastest, most explosive motions the human body is capable of producing. It is lethal speed,
Lethal speed.
and possessing the ability to throw a projectile with lethal speed and pinpoint precision changed the rules of survival.
Because we could hunt from far away?
Exactly. It meant early humans could hunt large, dangerous prey from a safe distance. It meant we could defend our territory against apex predators without having to engage in close-quarters hand-to-hand combat.
Right, because if an early human gets into a wrestling match with a saber-toothed cat...
The human loses every single time.
Okay, so we traded thick, bony, defensive armor and stability for range and projectile weapons.
We traded brute strength for biomechanical velocity. And the beautiful paradox is that later in our evolution, that exact same hypermobile shallow joint that let us throw spears allowed for the micro-movements required to build civilization.
Like what?
To paint on cave walls, to manipulate tiny tools, to write manuscripts, and to play the violin. The evolutionary freedom of the shoulder literally built our world.
Okay, that completely reframes how I look at my own body. The shoulder isn't a design flaw. It's a high-performance sports car engine that we just use to get groceries.
That's a great way to put it.
But this immediately brings up a massive mechanical problem.
Which is?
If the bones are just a golf ball resting precariously on a flat tee, and we are violently whipping this arm around at 9,000 degrees per second to throw a baseball,
Yeah.
how on earth does the golf ball stay on the tee?
Ah, the million-dollar question.
Right. What is physically keeping my arm from ripping right off my torso and flying through the air along with the baseball?
That mechanical problem is solved by the unsung heroes of your anatomy. The structures that do the invisible, impossible math of keeping the joint together.
We are talking about the four muscles of the rotator cuff.
Exactly.
Now, if you ask the average person on the street to point to their shoulder muscle, they're going to point to the deltoid.
Sure.
That's the big, visible, rounded muscle on the outside of the upper arm, the one that bodybuilders spend hours in the gym trying to grow to get those broad shoulders.
And the deltoid is undeniably the powerhouse.
Mhm.
It is the primary engine of the shoulder.
Right.
But from a pure physics and biomechanical standpoint, the deltoid is what we call a dumb motor.
A dumb motor. It's just brute force with no brain.
Exactly. The deltoid has immense lifting power, but it has absolutely zero intrinsic stabilizing function.
Why is that?
To understand why, you have to look at the vector of its pull. Because of where the deltoid attaches on the arm bone and where it anchors up on the collarbone and shoulder blade, its primary line of force is almost entirely vertical.
Okay, pulling straight up.
Right. If you severed every other muscle in the shoulder and told the deltoid to contract, it wouldn't elegantly lift your arm out to the side.
What would it do?
The moment it fired, it would violently pull the humerus bone, the golf ball, straight upward.
Oh, I see. It would just yank the ball right off the tee.
Worse than that,
Word.
directly above the golf ball is a hard, bony overhang, a piece of the shoulder blade called the acromion. It acts as a roof over the joint.
Okay, a bony roof.
If the deltoid worked alone, pulling straight up, it would immediately crush the head of the humerus directly into that bony roof.
Ouch.
You would have an instant, agonizing bone-on-bone collision, and you wouldn't be able to lift your arm more than a few inches before it physically jammed.
So the deltoid is just raw, upward pulling power, completely oblivious to the delicate machinery around it.
It needs an intelligent steering system to manage that raw power.
And that's the cuff.
It needs a mechanism that can actively pull the golf ball downward and center it perfectly on the tee at the exact millisecond the deltoid starts pulling upward. That intelligent, micromanaging steering system is the rotator cuff.
Let's break down the individual members of the steering system because our sources profile them in fascinating detail.
That's a great crew.
The rotator cuff is made up of 4 distinct muscles, each acting as a highly specialized pillar. Let's start with the one that sits on top. The supraspinatus.
The supraspinatus is a fascinating muscle. It sits right on top of the shoulder blade in a little depression, and its tendon runs directly over the top of the humerus bone to attach to the outside edge.
Okay, so running right over the top.
In terms of mechanics, its primary job is to initiate movement.
Like the starter motor in a car.
Precisely. When you are standing with your arms resting at your sides, the deltoid is at a terrible mechanical disadvantage. It can't get the leverage to start lifting the arm.
So it needs help getting going.
If you decide to raise your arm straight out to the side of motion, called abduction, the supraspinatus is the muscle that fires first.
Okay.
It handles the critical first 0 to 30 degrees of the lift. It gently pulls the arm away from the body, and more importantly, it creates a downward force vector that pins the head of the humerus against the socket.
Giving the deltoid clearance.
Exactly. It gives the deltoid the clearance and leverage it needs to take over the rest of the movement.
It gets the heavy lifting going smoothly so the dumb motor doesn't crush the joint.
That's it.
But the connexiformation sources highlight a really grim statistic about this specific muscle. They note that the supraspinatus is the most frequently injured tendon in the entire shoulder.
It takes a beating.
Something like over 80% of all rotator cuff pathologies involve this one specific starter motor. Why is it taking so much damage?
It comes down to real estate.
Location, location, location.
Exactly. The supraspinatus lives in an incredibly dangerous anatomical neighborhood. To get from the shoulder blade to its attachment point on the arm bone, the tendon has to pass through a tiny, unforgiving bone tunnel.
Underneath that roof we talked about.
Yes. It's known as the subacromial space.
Yeah.
It is literally sandwiched between the top of the moving arm bone below it and the hard, stationary, bony roof of the acromion above it.
That sounds cramped.
It has to do all of its crucial, heavy-lifting starter work while trapped inside a vise.
We are definitely going to circle back to the horrors of that bone tunnel later. But let's move around the joint. So we have the starter on top. Next, the sources group 2 muscles together on the back of the shoulder blade.
The infraspinatus and the teres minor.
Right. What are they doing back there?
These two occupy the broad, flat back surface of your shoulder blade. Their primary concentric job when they shorten is external rotation.
So turning the arm outward.
They are the muscles that turn your arm outward, like when you're drawing that post-string back to throw.
Okay, got it.
But their true biomechanical genius, and the reason athletes depend on them, lies in what they do when they are lengthening.
Lengthening under tension. That's an eccentric contraction, right?
Exactly. Think back to our baseball pitcher throwing the ball at lethal speed.
Okay, 9,000 degrees a second.
When the arm is whipping forward and the ball finally leaves the pitcher's hand, the arm itself is still traveling at an astonishing velocity.
Right. It doesn't just stop instantly.
It carries massive forward momentum. Without a braking system, The arm would literally rip right out the front of the socket and follow the ball to home plate.
The follow-through of the pitch.
Yes. During that violent follow-through, the infraspinatus and creases minor have to fire eccentrically.
So they're pulling back while being stretched forward.
Exactly. They are trying to contract and pull the arm back at the exact same time they are being violently stretched forward by the momentum of the humerus.
They are the emergency brakes of the shoulder.
And the physical forces they have to absorb during this braking phase are almost unbelievable.
How much force are we talking?
The biomechanical data shows they regularly handle between 1,000 and 1,200 newtons of force.
Okay, let me pause and translate that. A newton is the standard unit of force. What does 1,200 newtons actually feel like? How much weight is that?
In everyday terms, it translates to roughly 150% of an average person's total body weight.
Wait, 1.5 times your entire body weight?
Yes.
That's insane.
Imagine taking 1.5 times your body weight, converting it into raw pulling force, and concentrating all of it onto a few square centimeters of tendon at the back of your shoulder.
For just a fraction of a second.
Violently pulling backward to stop your arm from flying off, that is the eccentric workload these two muscles manage.
This is why athletes who perform high-velocity throwing, like pitchers, tear their shoulders up.
Baseball pitchers, handball players, tennis players, during a serve, they so frequently suffer from catastrophic wear and tear in these posterior tendons. They are quite literally burning through their brake pads.
That is awe-inspiring. Okay, so we have the starter motor trapped in a tunnel on top and the heavy-duty emergency brakes on the back. That leaves the front of the shoulder.
The subscapularis.
The subscapularis. It is the absolute unit of the rotator cuff family.
The heavy hitter.
It is a massive muscle that hides entirely on the front side of the shoulder blade, deeply sandwiched between the blade itself and the back of your rib cage.
So you can't even see it from the outside.
You can't. It is the largest, the thickest, and the most powerful of the 4 pillars. To give you an idea of its size, the tendon of the subscapularis alone is 5 to 6 centimeters wide and 4 to 5 millimeters thick.
Wow, that's huge compared to the others.
It is roughly double the thickness and width of the other rotator cuff tendons.
A massive, thick band of tissue guarding the front.
Hmm.
What is its primary job?
Its active motion is internal rotation.
Pulling the arm in?
Right, pulling your arm powerfully across your chest or stomach, like when you arm wrestle.
Oh, sure.
But its structural job is much more critical. It acts as an anti-dislocation deadbolt. A deadbolt.
Yes. When you cock your arm back to throw, you are pushing the head of the humerus aggressively forward, right against the front edge of the shallow T.
Right, pushing it toward the front.
Without something to stop it, it would just pop right over the edge. The subscapularis acts as a thick, unyielding physical wall, catching the bone and preventing the humerus from slipping out the front.
Which is important because
Since the vast majority of shoulder dislocations happen anteriorly, meaning out the front, the subscapularis is your primary active defense system, keeping the joint intact.
okay, so that's the core crew, the 4 pillars: supraspinatus, infraspinatus, teres minor, and subscapularis.
That's the main 4, yes.
But connexoformation's anatomical breakdown highlights a 5th element, a passenger that rides along with the cuff, the tendon of the long head of the biceps.
Yes, the 5th musketeer.
Now, the biceps is the muscle on the front of your arm, the classic Popeye muscle you use to do a bicep curl. What is it doing all the way up in the shoulder joint?
It's one of the strangest and most unique anatomical quirks in the body. The biceps muscle has 2 tendons that attach at the top, which is why it's called the biceps, meaning 2 heads.
Okay, that makes sense.
The short head attaches outside the joint to a little bony hook on the shoulder blade. Very standard.
Sure.
But the tendon for the long head of the biceps does something entirely unorthodox. It travels all the way up the front of the arm bone, enters a groove, and then actually pierces the joint capsule and weaves directly inside the sealed shoulder joint.
It physically runs naked inside the joint space.
It does. It is the only tendon in the entire human body that is completely synovialized,
Meaning what?
meaning it is bathed in joint fluid, running freely inside an articulation. It travels directly over the very top of the humerus golf ball before finally attaching to the top lip of the socket.
That routing is bizarre. Why is it in there?
Because of this bizarre routing, it acts as a superior suspension cable. When your arm is moving, and especially when the rotator cuff gets fatigued or if the supraspinatus starter motor is injured,
Right, the one that gets hurt the most.
that biceps tendon tightly straps down over the top of the bone. It acts as a passive restraint, pushing the humeral head down and assisting the cuff in keeping the bone from hitting the acromion roof.
So it's a backup system.
It is a vital backup system, a fifth musketeer riding along with the primary four.
Which brings us to the actual physics of how these muscles interact. Because Dr. DeLong's research emphasizes that we shouldn't think of these muscles as isolated rubber bands just pulling on a bone.
No, that's a terrible way to visualize it.
We need to understand the biomechanics of what they call dynamic centering. Our sources describe the tendons of the rotator cuff not as separate strings, but as a continuous sheet or a hood. In fact, the French clinical term is coiffe de rotateur, and coiffe literally translates to hood.
That terminology is crucial for visualizing how this works.
The hood.
Yes. As the tendons of these four distinct muscles leave their respective locations on the shoulder blade and reach the humerus, they don't just attach to four separate little dots on the bone.
They don't.
No, they physically fan out, spread wide, and weave their fibers directly into one another. They fuse into a continuous, unbroken fibrous blanket that wraps around the entire upper half of the humerus.
How like a web.
This interwoven design is vital because it allows the muscles to instantly redistribute mechanical stress and pull together as a single functional unit.
Okay, let me try an analogy here to see if I am grasping the physics of this continuous hood.
Go for it.
It sounds to me exactly like pitching a very complex, heavy canvas circus tent.
Okay, I like that.
You have a central support pole, which would be the humerus, the arm bone. To keep that central pole perfectly upright and stable so it doesn't fall over, you have to peg down guy lines on all sides of the tent.
Right, tension from all sides.
If you go to the front of the tent and pull the front guy lines really, really hard, but you don't have an equal amount of tension on the guy lines in the back, the central pole immediately leans forward, the base kicks out, and the entire tent collapses. Or the pole snaps.
That is a brilliant way to visualize it. In biomechanical engineering, this precise requirement for equal and opposite tension is called the concept of force couples.
Force couples.
You cannot have stability without perfectly counterbalanced forces. Let's look at the actual numbers measured in the shoulder.
Okay, let's hear the numbers.
In the front of the joint, you have that massive, thick subscapularis muscle pulling the front of the tent inward and downward. It generates a force of roughly 180 to 220 newtons.
So that's the heavy tension on the front guy line.
Exactly. To balance that immense pull, you look to the back of the joint. You have the infraspinatus and teres minor.
The emergency brakes.
Right. Together, they pull the back of the tent with a combined force of about 160 to 200 newtons.
Wow. The forces are nearly perfectly symmetrical.
They absolutely have to be, because this oppositional pulling front to back does something incredibly elegant.
It holds the pole up.
It doesn't lock the joint rigidly in place, which would defeat the purpose of our 1800 degrees of freedom.
Yeah.
Instead, it creates a phenomenon called dynamic articular compression.
Dynamic.
Because the muscles in the front and the muscles in the back are pulling simultaneously inward toward the socket, they squeeze the golf ball deep into the tee.
Oh, they pinch it inward.
And they do this dynamically, constantly adjusting as you move. Just by lifting your arm empty-handed to wave hello to someone across the street, these muscles are actively squeezing the joint together with a compressive force equal to 40 to 50% of your total body weight.
Wait, what? That is stunning. I am just waving my hand, holding zero weight, and my rotator cuff is internally generating 50 to 80 pounds of compressive force just to keep my arm from slipping off the tee.
Yes. And if you are holding a heavy load, say picking up a heavy suitcase or a child,
It goes up.
that internal compression force spikes to exceed 100% of your body weight.
That is insane.
That is the magic of dynamic centering. It forcefully anchors the pivot point of the joint down to the millimeter.
It essentially creates a fake socket.
It creates a temporary high-pressure artificial socket so that the dumb motor of the deltoid can safely rotate the arm without the bone shifting a fraction of an inch out of place. It's a miracle of physics that happens thousands of times a day, entirely subconsciously.
It is genuinely mind-blowing when you break it down like that, but it also makes me wonder how our specific evolutionary solution compares to the rest of the natural world.
It's very different.
If our human shoulder is this highly specialized tent relying on millimeter-perfect dynamic compression, how do other animals operate? Like, do dogs get rotator cuff tears from chasing tennis balls?
Mostly no.
Do gorillas have to worry about their force couples?
It's a great question, because every mammal has a rotator cuff. The anatomical blueprint is shared. But evolution has tuned the cuff completely differently in different species.
Depending on what they need to do, right?
depending entirely on how they navigate their environment. Let's start with the gorillas and chimpanzees you mentioned.
Right, the primates who can't throw but can swing through the jungle effortlessly.
Exactly. Their primary mode of locomotion is called brachiation, swinging from branch to branch.
Okay.
Because they are constantly hanging overhead, gravity is trying to pull their arms out of the sockets through traction, not pushing them down through compression.
Ah, so they're being pulled apart.
Therefore, their rotator cuffs are enormously powerful. Proportionally, their rotator cuff muscles are much larger and thicker than ours.
Just built for raw holding power.
They act as heavy-duty suspension straps optimized to sustain their entire body weight while being violently pulled. They sacrifice the fine, delicate balancing act of human dynamic centering for raw, unyielding grip strength.
That makes perfect sense for a tree-dwelling ape. What about quadruped animals? Things that walk on all four legs, like a dog, a cat, or a horse.
Well, for a quadruped, the front limb is a true column. Gravity does the hard work of keeping the joint compressed.
The earth pushes up, the dog pushes down.
The weight of the dog pushes the shoulder blade down onto the arm bone, locking it in place. So a dog's rotator cuff doesn't need to perform this complex, empty space dynamic centering.
Because it's not dangling.
Right. The dog doesn't need to lift its paw out to the side or behind its back. Its leg just acts like a pendulum moving forward and backward.
So what does the dog's cuff do?
In quadrupeds, the rotator cuff muscles function more like rigid side cables on a bridge. Their only real job is to prevent lateral wobbling when the animal runs.
They just act as bumpers to keep the leg tracking in a straight line.
Exactly. And the horse provides one of the most extreme examples of this specialization.
Oh, horses are wild.
A horse has a massive, highly developed supraspinatus muscle,
The starter motor.
but it isn't used to lift the leg out to the side like our starter motor does. In a horse, the supraspinatus is a critical component of what's called their stay apparatuses.
Stay apparatus.
Its primary function is to contract and rigidly lock the shoulder joint into deep extension. It turns the leg into a solid, immovable post, which allows the horse to literally go to sleep standing up without experiencing any muscle fatigue in its upper body.
That is wild. The exact same muscle we use to gently lift our arm, a horse uses as a locking mechanism to sleep.
Repurposed by evolution.
What about animals that don't deal with standard gravity at all, like marine mammals? Do dolphins and whales even have shoulders?
They absolutely do. Deep inside their flippers, hidden beneath the blubber, they possess the exact same skeletal and muscular blueprint inherited from their ancient terrestrial ancestors.
So they have the whole setup.
They have a shoulder blade, a humerus, and rotator cuff muscles. But for a dolphin, gravity isn't the primary force, water density is.
Right.
Their rotator cuff is repurposed as an incredibly powerful hydrodynamic steering mechanism. It acts as a rudder control system, allowing them to rapidly orient the flipper against the immensely dense pressure of water to navigate, spin, and turn at high speeds.
Okay, the marine mammals are cool, but the final comparison in the connexoformation research blew my mind.
The birds.
Birds. How does a bird's shoulder work? Because they are generating lift, not just dealing with gravity.
Birds have taken the basic vertebrate shoulder anatomy and completely inverted the mechanics to achieve flight.
Inverted it.
In a human, the muscle that lifts the arm, the supraspinatus and the deltoid, sits on top of the shoulder.
Right.
But birds need a massive, incredibly strong muscle to aggressively snap the wing upward during the upstroke of flight. Having a giant, heavy muscle sitting on top of their wing would ruin their center of gravity and make them top-heavy.
They just flip over in the air.
Exactly. So evolution moved the muscles to their chest. The primary muscle for lifting a bird's wing, the supracoracoideus, is located flat on their breastbone, right underneath their massive downward flapping flight muscles.
Wait, I'm trying to picture this. The muscle designed to violently pull the wing, UP, is located on their chest, facing down. How does pulling down make the wing go up?
Through a biological reverse pulley system.
A pulley, inside a bird.
To make this work, the tendon of this chest muscle travels straight upward, passes completely through a literal anatomical hole located where their shoulder bones meet, called the trioceal canal, and then loops over the top of the joint to attach to the top of the wing bone.
That is unbelievable.
It is brilliant engineering. When the muscle on the bird's chest contracts, it pulls the tendon downward. The tendon slides through the bony hole, acting exactly like a rope running over a pulley wheel, and violently hoists the wing upward for takeoff.
Wow.
It keeps all the heavy muscle mass centered on the bird's chest for aerodynamic stability, while still delivering upward force to the wing.
Nature is just showing off at this point. A rope and pulley system built through a hole in the bone, but running through all these incredible animal adaptations brings us right back to our own reality. The human tax.
Yes, bill comes due.
When you observe how specialized these other animals are, the horse locking its rigid column to sleep, the dog using simple side cables, the bird relying on a centered pulley, you realize that humans ask the most ridiculous biologically demanding things of our shoulders.
It's unfair to the joint, really.
We require this delicate, complex ring of force-coupled muscles to work continuously in every conceivable direction, constantly fighting gravity while entirely suspended in empty space.
And while frequently holding heavy, unpredictable objects at the end of a long lever arm.
We don't have the solid, compressed pillar of a dog's leg to rest on. We are operating a crane on a tightrope.
And that, fundamentally, is why human beings suffer from more shoulder injuries than almost any other creature.
And that reality is the perfect pivot point into the darker side of this deep dive. Because here is where things get intensely relevant and perhaps a little bit personal for anyone listening who has ever felt that sharp, warning twinge in their shoulder when reaching into the back seat of their car.
I think we've all felt that twinge.
With all of this miraculous, millimeter-perfect, dynamic centering happening, why do so many people suffer from chronic shoulder pain?
Because perfection degrades over time.
It wears out.
The statistical reality of the human shoulder is sobering. The natural aging and fraying of the rotator cuff is so incredibly common and so biologically inevitable across our species that rheumatologists and orthopedic surgeons literally refer to these tears not as injuries, but as the wrinkles of the shoulder.
The wrinkles of the shoulder. So you're saying a torn rotator cuff is just a normal part of getting older, like getting gray hair.
Exactly. Look at the large-scale epidemiological studies cited by Dr. Delong. By the age of 60, roughly 25% of the general population has a complete, full-thickness tear in at least one of their rotator cuff tendons.
25%, that's 1 in 4.
And as we continue to age, the curve steepens dramatically. By the time a population reaches 80 years old, that number jumps to over 50%.
Over half of all 80-year-olds are walking around with a completely torn, detached shoulder tendon.
Yes.
That's horrifying.
And here is the truly fascinating part that confuses so many patients. A vast majority of those 80-year-olds with massive, gaping holes in their rotator cuffs have absolutely no idea.
I have no idea. They don't feel it.
They experience zero pain and maintain highly functional lives.
We are absolutely going to dive into the neurology of how you can have a torn tendon and feel no pain in a few minutes, because that sounds like magic. But first, let's establish the pathology. Why is it tearing in the first place?
Well, there are a few reasons.
If it's not an acute injury like falling off a ladder, what are the chronic enemies slowly destroying the cuff?
There are 3 primary biological enemies. The first is a pure, simple lack of anatomical space.
Ah, the bone tunnel.
Right. Remember earlier when we talked about the supraspinatus tendon, the starter motor, and how it has to pass through that bone tunnel called the subacromial space?
Yes, sandwiched between the arm bone below and the shoulder blade roof above.
When your arm is just resting neutrally at your side, the height of that gap is only about 7 to 14 millimeters. It's tiny.
Okay, super narrow.
Now, lift your arm. If you're listening to this, try raising your arm straight out to the side. As you do that, the complex geometry of the joint rolling upward causes that already tiny space to shrink dramatically.
Oh, small.
Often to under 5 millimeters. Every single time you lift your arm above your head, the tendon is compressed. It is working inside an absolute vice.
So it's getting squeezed just from normal movement.
If you compare this to your Achilles tendon in your heel, the Achilles has plenty of open space to stretch and glide. The rotator cuff, by contrast, is constantly, repeatedly being squeezed between a rock and a hard place.
And doing that tens of thousands of times over a lifetime, reaching for cabinets, putting on shirts, swimming has to cause some severe mechanical fraying.
It does, which perfectly leads to the second enemy.
Which is?
The Sander effect.
The Sander effect, like sandpaper.
Exactly. As we age, our bones don't just stay perfectly smooth. In response to stress and friction, they remodel themselves. Many people naturally develop tiny, sharp bone spurs on the underside of that acromine roof. In the medical field, they visually describe these osteophytes as parrot beaks because of how they curve downward.
That sounds absolutely awful. Tiny parrot beaks growing inside your joint.
And because they grow downward into that already microscopic 5-millimeter gap, they act exactly like a piece of coarse grit sandpaper.
Grinding against the tendon.
Every time you lift your arm, Those bony parrot beaks literally sand down the top layer of the supraspinatus tendon. It is a slow, relentless mechanical erosion. Over decades, it systematically grinds the fibers of the tendon away until it finally snaps.
So we have the vise of the bone tunnel and we have the sandpaper of the parrot beaks. What is the third enemy?
The third enemy is a massive inherent biological design flaw known as Codman's critical zone.
Now, wait a minute. You spent the first 20 minutes of this discussion convincing me that the shoulder was an evolutionary masterpiece and not a flaw.
Well, the macrostructure, 1800 degrees of freedom, the force couples, is a brilliant evolutionary compromise. But the microplumbing, the vascular infrastructure feeding those muscles, that leaves a lot to be desired.
Okay, tell me about the plumbing.
Dr. Ernest Codman discovered that about 10 to 15 millimeters away from where the supraspinatus tendon physically anchors to the humerus bone, there is a natural dead zone.
A dead zone, meaning what?
Meaning this specific patch of tendon tissue exists in a vascular watershed area. It has almost no capillary blood vessels supplying it.
So no blood.
Right. The microcirculation in this exact spot is constitutionally deficient from birth. It is a desert.
And in the human body, blood brings the materials required for healing.
Exactly. When a normal muscle, like your bicep or your quad, gets a micro tear from a heavy workout, rich oxygenated blood rushes into the tissue carrying nutrients and repair cells.
And it heals up stronger.
It heals stronger in a few days.
Yeah.
But when you get a micro tear in Codman's critical zone, say from throwing a ball a little too hard on the weekend or lifting a heavy box awkwardly, there is no blood supply to bring those repair materials.
That's how odd.
The tear simply cannot heal.
It just stays torn.
It stays torn. So over months, years, and decades, these tiny unhealed microlesions begin to accumulate within the tendon. Because it can't regenerate, the tendon tissue degenerates.
It just breaks down over time.
It loses its youthful elasticity, it becomes dry, brittle, and fibrotic, and eventually, under a normal everyday load, the brittle fibers give way and the tendon ruptures entirely.
That is incredibly bleak. It's just sitting there silently accumulating damage, totally unable to fix itself.
It is grim.
Our sources from Kinematics Formation also mention some hidden culprits that dramatically speed up this degenerative process, lifestyle factors that interact with this dead zone.
Yes, and this is crucial for the listener to understand. Because Codman's critical zone is already starving for blood on a good day, anything you do that damages your body's overall vascular system is going to actively destroy your rotator cuff.
Okay, what destroys the vascular system?
Smoking is a massive, well-documented enemy of the shoulder. Nicotine is a powerful vasoconstrictor. It aggressively shrinks blood vessels.
You already don't have enough blood there.
When you smoke, you are literally choking off what little fragile microcirculation exists in that dead zone, suffocating the tendon cells.
Wow.
Orthopedic surgeons often see vastly higher rates of failure in rotator cuff surgical repairs in patients who smoke, simply because the tissue is too starved of oxygen to heal the sutures.
What other lifestyle factors choke the cuff?
Metabolic diseases like diabetes and chronically high cholesterol.
Really? Cholesterol affects your shoulder.
Absolutely. These conditions fundamentally warp the quality of the collagen matrix in your body. High blood sugar causes advanced glycation end products, which cross-link the collagen fibers inappropriately.
Meaning they get stiff.
They make the tendons physically stiffer, more brittle, and much more prone to developing painful, chalky calcium deposits right inside the tissue itself. Your shoulder health is intimately directly tied to your overall metabolic and vascular health.
Okay, this brings us to a glaring contradiction in the clinical literature, a mystery that I need you to solve.
Let's hear it.
You just told me a few minutes ago that 50% of 80-year-olds have completely torn rotator cuffs and feel absolutely no pain.
Yes.
But anyone who has ever had a shoulder impingement or a symptomatic torn cuff knows it can be some of the most agonizing, tear-inducing pain imaginable, the kind of pain that ruins your life for months.
It is incredibly painful.
So if tears are so incredibly common and so often completely painless, why do some shoulder injuries hurt so incredibly much?
The answer to that mystery doesn't lie in the tendon itself. Tendons actually have relatively few pain receptors.
Really? Then what hurts?
The agonizing pain you are describing originates in a tiny neighboring structure called the bursa, specifically the subacromial bursa.
The bursa. I hear that word thrown around a lot, bursitis. What exactly is a bursa, mechanically speaking?
Imagine a tiny, flat, heavy-duty plastic bag, completely sealed, and filled with a single drop of highly viscous, slippery, lubricating gel.
Okay, like a little packet.
That is essentially what a bursa is. It sits right in the middle of that tiny 5 mm gap, sandwiched directly between the top of the moving rotator cuff tendon and the hard, stationary bony roof of the acromion.
Oh, so it's right in the danger zone.
Its biological job is to act as a friction-reducing cushion, a biological ball bearing. When you lift your arm, the tendon doesn't grind roughly against the bone. It glides smoothly and silently against the slick surface of the bursa.
Okay, so the bursa is a good thing. It's a shock absorber and a lubricant.
It is a vital thing, but it has one critical anatomical difference from the tendon. While the tendon is a vascular desert with few nerves, the bursa is highly vascularized and absolutely truffled with nerve endings.
So it feels everything.
It is a highly sensitive, hyperreactive alarm system designed to detect friction and joint stress.
Ah, so when the structural mechanics go wrong, the alarm trips.
And when it trips, it screams. Imagine your supraspinatus tendon gets slightly frayed from overuse or irritated by those bony parrot beaks.
The tendon swells.
The tendon becomes inflamed and swells up. It gets physically thicker. Suddenly, it starts rubbing aggressively against the bursa. To protect the joint from this new friction, the bursa's natural response is to produce more lubricating fluid.
So it swells up.
It swells up, becoming engorged and thick to create a better cushion.
But wait, we just established there is absolutely no extra space in that subacromial tunnel. It's only 5 millimeters.
Precisely the problem. The inflamed, swollen tendon and the fluid-engorged, swollen bursa are now fighting for space inside a microscopic, unyielding, bony tunnel.
That sounds like torture.
Every time you try to lift your arm, the bursa gets brutally, violently pinched and crushed against the ceiling of the joint. This intense crushing causes acute inflammation, a bursitis.
And because it has so many nerves.
Because the bursa is packed with pain nerves, the signal it sends to your brain is electric, sharp, and agonizing.
This perfectly explains a phenomenon described in the Kinematics text called the painful arc. How does that arc work mechanically?
The painful arc is a classic diagnostic sign used by doctors. A patient with severe bursitis can usually lift their arm the first few inches away from their body with very little pain.
Why is the bottom of the movement okay?
Because at the bottom of the movement, the space is still somewhat open. The bursa isn't being crushed yet. But as the arm reaches about 60 degrees, roughly shoulder height, and continues up to about 120 degrees,
What happens?
the complex rolling geometry of the joint causes that specific tunnel to hit its absolute tightest, narrowest point.
The vice clamps completely shut.
Exactly. The swollen bursa is squeezed like a grape in a vice. The patient will often wince or cry out in sharp pain through that specific 60 to 120 degree arc of movement.
But it gets better after that.
Paradoxically, yes. If they can push through the pain and get their arm all the way up near their ear, the humerus bone clears the edge of the roof, the space opens back up on the other side, the pressure on the bursa drops, and the pain suddenly vanishes.
That makes so much structural sense. But what about the most common complaint of all? I think a lot of listeners will heavily relate to this.
The night pain.
Yes. Why does a bad shoulder always seem to hurt 10 times worse at night? You're not lifting anything, you're not moving, you're just trying to lie in bed and sleep, and suddenly the shoulder starts throbbing uncontrollably.
Orthopedists call it the night of the bursitis.
Yeah.
It is the #1 reason patients finally seek medical help.
Really? Because they just can't sleep.
They say, I can manage the pain during the day, but I haven't slept in weeks. It all comes down to the physics of gravity and resting muscle tone.
Gravity again.
During the day, when you are standing or walking around, the physical weight of your arm, which is quite heavy, maybe 8 to 10 pounds, is constantly pulling downward.
Right.
Gravity is actively pulling the head of the humerus slightly down, which artificially opens up that subacromial space just a tiny fraction of a millimeter.
Right.
Gravity is your friend. It physically decompresses the bursa.
Oh, wow. I see where this is going when you lie down.
Yes. When you lie horizontally in bed, gravity is no longer pulling the arm down toward the floor. The downward traction is gone.
And the space closes.
Furthermore, even when you are deeply asleep, your muscles never completely shut off. They maintain a baseline level of tension, or resting tone.
Okay.
Without the heavy weight of the arm pulling down against them, that natural muscle tone pulls the head of the humerus slightly upward into the socket. The golf ball slowly rises up and steadily, continuously crushes the inflamed bursa against the ceiling of the joint.
So you go from intermittent pinching during the day to a constant, unyielding crush all night long.
You have constant, uninterrupted compression of a highly inflamed, nerve-dense tissue. To make matters worse, the lack of movement while you sleep means your blood circulation slows down.
And things pool.
The inflammatory fluids pool and stagnate in the joint area, increasing the internal pressure even more. It leads to this deep, radiating, throbbing, toothache-like pain in the shoulder that makes sleep utterly impossible.
Okay, if our listener has a tear or is currently suffering from a bout of bursitis, everything we've just discussed sounds incredibly bleak. It sounds like an inescapable mechanical trap.
You can definitely feel that way to the patient.
But I want to pivot here because the final chapters of our source material read like a message of profound biological hope. Let's circle back to that ultimate paradox.
The painless tears.
Yes.
Hmm.
Massive, gaping holes in the rotator cuff. Completely painless, perfect function. How is that physically achieved?
If we zoom out and connect this to the bigger picture of human biology, we arrive at the golden rule of modern orthopedics.
Which is?
Treat the patient, not the MRI image. You can take a 65-year-old woman, put her in an MRI machine, and the scan will show a massive, fully retracted tear. Her supraspinatus starter motor is completely gone. The tendon is gone.
Gone.
And yet she gets out of the MRI, lifts her arms, puts on her coat, carries heavy bags of groceries to her car, and plays a full game of tennis without a single wince of pain.
How is that physically possible? We just spent an hour establishing that the entire tent collapses if one of the guy lines breaks. If the starter motor is gone, shouldn't the dumb motor of the deltoid just crush the bone into the roof immediately?
In a purely mechanical robot, yes, the joint would fail instantly. But it's possible in humans because of the brain and the miraculous concept of neurological plasticity.
The brain takes over.
The brain is the ultimate hyper-intelligent project manager of the body. When the tendon tears, the brain immediately recognizes the mechanical failure. Interestingly, sometimes its very prompt reaction is purely defensive.
Defensive how?
If a tendon is severely inflamed or partially torn but not fully ruptured, the brain assesses that moving the arm will cause catastrophic damage. So the brain might act as a breaker switch and literally shut off the electrical motor signal to that muscle to protect it.
Like blowing a fuse to save the electrical panel.
Exactly. The patient comes into the clinic and they feel like their arm is completely paralyzed. They physically cannot lift it out to the side.
But the muscle is still attached.
We call this clinical presentation a pseudoparalysis. The muscle tissue is totally fine, the nerve pathways are perfectly intact, but the brain's software has placed a hard lock on the movement. It refuses to send the signal because the proprioceptive sensors in the joint are screaming that a tear is imminent.
But how do they get function back if the tendon actually tears completely? If the brain isn't just protecting it, but the muscle is truly unattached?
Through aggressive neurological compensation, the brain realizes the front guy line of the tent is snapped, so it rapidly begins recruiting backup generators.
Which are what?
It completely rewires the motor patterns of the upper body. Through natural adaptation, or more often through highly specialized targeted physical therapy, the brain can literally teach the dumb deltoid muscle to pull differently.
Wait, how do you teach a muscle to pull differently? It's just a muscle.
The deltoid isn't just one block of muscle. It has distinct fibers in the front, middle, and back. The brain learns to sequence the firing of these fibers.
Oh, interesting.
Instead of just firing everything at once and pulling straight up, the brain trains the anterior and posterior fibers of the deltoid to contract in a highly specific sequence that actually helps push the ball downward into the socket, mimicking the lost rotator cuff.
So the dumb motor gets a massive software update and learns how to steer the bone itself.
Precisely. But the re-educated deltoid can't do it alone. The brain also recruits a massive shadow team of muscles to change the geometry of the joint.
The shadow team.
Remember that the shoulder blade, the T that the golf ball sits on, isn't bolted down. It floats freely on the back of the ribcage.
Right.
If the rotator cuff is weak and can't hold the ball on the tee, the brain recruits the scapula fixators muscles, like the serratus anterior, which wraps around your ribs, and the trapezius on your back.
What do these shadow muscles do to help?
They physically tilt and upwardly rotate the entire shoulder blade.
They move the T.
Exactly. By changing the angle of the floating tee itself, they present a better, more supportive horizontal angle to the golf ball. They effectively tilt the socket up to catch the ball from below, preventing it from sliding upward into the roof, entirely bypassing the need for a functioning supraspinatus.
That is genius. If the tent pole is leaning because a guy line snapped, You just tilt the ground underneath the pole to keep it balanced.
Yes. And finally, if all else fails, the brain recruits the heavy artillery.
Which is?
The latissimus dorsi in your back and the pectoralis major in your chest. These are massive, incredibly powerful muscles that attach to the arm bone and pull downward.
And the brain uses those.
By permanently increasing their baseline resting tone, the brain uses them as heavy-duty active pull-down straps. They constantly aggressively fight the upward pull of the deltoid, keeping the bone forcibly depressed and away from the acromion roof.
The result being a perfectly functional arm.
The result is what orthopedic surgeons call a compensated shoulder. The original, delicate precision watchmaker parts are broken and gone. But the brain has constructed a highly functional, robust suit of muscular armor around the joint to keep the arm working perfectly.
That is truly the magic of the human body. It absolutely refuses to fail.
It adapts. Given the right stimuli and the right physical therapy, it almost always adapts.
So what does this all mean for us? We've reached the end of this deep dive, and it's time to distill this massive amount of biomechanical information down.
It's a lot to take in.
The rotator cuff is not some fragile, poorly designed mistake that just exists to torture us with bursitis as we age.
None at all.
It is a highly specialized, hyper-athletic biological structure. It is a wildly complex web of force couples, dynamic articular compression, and neurological plasticity that manages to balance a golf ball on a flat tee while we whip it around at 9,000 degrees a second.
It's a marvel.
It is the literal biological tax we pay for the evolutionary freedom to throw a baseball, to paint a masterpiece, or to simply reach the top shelf in the kitchen.
Without that compromise, we wouldn't be human. It is the defining mechanical feature of our upper body.
Which leaves me with one final, very provocative thought for you to mull over as you go about the rest of your day.
Oh.
We've just spent this entire hour establishing that your shoulders evolved over millions of years to be perfectly suspended, finely tuned mechanisms designed for throwing spears, climbing trees, and complex three-dimensional movement.
Right.
So I want you to seriously ask yourself, what is the true evolutionary cost of what you are likely doing right now?
Sitting down.
What is the cost of spending 10 hours a day sitting completely motionless, hunched forward over a laptop keyboard, staring down at a glowing smartphone screen?
It's terrible for the joint.
By permanently rolling our shoulders forward and hunching our upper backs into a C shape, are we artificially collapsing that already microscopic 7-millimeter bone tunnel? Are we actively starving our evolutionary masterpiece of the complex overhead movement it biologically requires to survive and stay healthy?
It is an incredibly important question. We're taking a joint designed for limitless spatial freedom and locking it into a tiny, hunched, two-dimensional box. The biomechanical consequences of that are profound.
Absolutely. So right now, wherever you are listening to this, do your rotator cuff a massive favor. Stand up.
Roll those shoulders.
Physically pull your shoulder blades back and pull them down. Open up your chest, reach your arms out, and just take a moment to appreciate the incredible invisible engineering happening inside your joints right this very second. Thank you for joining us on this deep dive into the magnificent human shoulder. See you next time.